Okay. So welcome again to everybody. My name is Paul Goh. I'm the founder of Origo, and I'm back up with an excellent team of people. Inda, Mario, Joseph, and Jeffrey. Okay, and it is this team of people are the ones that actually are the people administrating the webinar while we are presenting it. So a big thank you to them. They are based in Indonesia, so which means that I'm eating to their dinner time. But no worries, you guys are probably eating some tea break in between, right? Now, together with me, I have also Jeannie. Jeannie will be our speaker for today. And Jeannie has been training with Origo for the past 2 years, 3 years, Jeannie? Jeannie, you're muted.
I think at least 3 years.
At least 3 years, right? So Jeannie is a play therapist. So I'll formally introduce to her later on. But today's topic is on helping children using play and creative arts therapy. This is actually a 1 full day course that we conducted live in Singapore. But because we wanted to give people a glimpse of what play therapy is, so we've invited Jeannie to do a 1 hour quick talk on what it is, together with some quick hands-on as well. Okay, so welcome those who have attended, those who are here. Okay, now quick intro to who Origo is. Origo is actually based in Singapore, is Singapore headquartered, and we aim to be Singapore Asia's premier provider of mental health training. So what does it mean when we talk about mental health? Mental health means things like depression, stress, anxiety. Mental health also to us means special needs like ADHD, autism. And mental health also talks about psychological causes, therapy skills, like your dialectical behavior therapy, for example. And we deliver quality practitioner-based courses. The word practitioner-based is very important to us because all our trainers, all our speakers are actually practitioners, people that work currently as therapists. And with their many years experience, they can actually deliver a lot of skills to us. So we are not interested in teaching knowledge as in book knowledge that you can find on Google. We're not interested in teaching that. We are interested in teaching you skills. And another keyword here is quality. Our courses are very high quality in the sense that they are approved for funding in Singapore. I'll talk about it a bit later on. But some of you have attended our courses, so you know what we're talking about, right? Now, if you've gone to our website, you can see this picture called Empowering You to Better Help Others. This is our mission. Who are the you? The you are caregivers and parents. It's important to us because what therapists like Jeannie brings about with them is specialized skills. But if you are a caregiver, if you are a parent, you can partner with them so that your child, so that the person you're supporting can be better helped. Because Jeannie can only see the child maybe once a week, once a 2 weeks, once a fortnight. But you are the parent, you are the caregiver, you see the child every day. And therefore, you can use the skills that Jeannie has taught you to apply immediately as and when required. For example, in the area of meltdown, lash out, you can straight away apply some skills to help the child to regulate the emotions. All right. So for caregivers and parents, they are people that we aspire to help very much because we want to help you to better help your kids so that they can be able to function well in life. Of course, social workers, counselors, psychologists will be helped with specialized skills like behavior therapy, all right, and trauma therapy, for example, because you will find that many of our courses do not just teach you, but guide you along in a very detailed way. Educators, some of you who register yourself as teachers. Some of you register as tutors. Some of you register as special needs teacher. Now, you will find in Origo, we help you to identify children that perhaps are not neurotypical and neurodiverse, and they help you to be able to work with these people and these children. So these are the main groups of people that we are interested in helping: caregivers, parents, social workers, helping professionals, and those in education. We want to give you the skills to help those that you are supporting. Okay, so let me just introduce Jeannie. Jeannie is somebody who I respect very much, somebody who works very well with me, and she has a master's degree in counseling, and then she went on to do further training in play therapy. Okay, we work very well, and I even recommend people to her, children to her for therapy sessions. So Jeannie, can I get you to talk a bit more of yourself and introduce your topic? Jeannie, please.
Okay, thank you so much, Paul. Thank you for coming, everyone. Very good evening to you. Yeah, just now Paul already introduced that I was actually a trained counselor, but just that in the process of helping a lot of children and young people, I feel that the traditional technique of counseling is not sufficient. That's why I start to branch out, and then I equip myself with play therapy skills. Yeah, so maybe now I can start to share my PowerPoint. Can you all see my slide? Yes, right? Okay, so thank you for coming again. Okay, so let's start with the definitions of play therapy. Actually, a lot of parents or some teachers, they are not very familiar of what play therapy is. So I have two sources of definition for play therapy today. One of the definition is from Play Therapy United Kingdom, which is Association of the Play Therapies in England. So in their website, they say play therapy is a type of therapy where play and arts materials are used as the main way for people to express themselves. So when we are talking about play therapy, it's actually a short forms of play and creative arts therapy. So it includes art materials as well. But when we are talking about art therapy, it doesn't include play. Also, we must know that actually play therapy includes art and craft materials. And also this is a way to help people to express themselves. It's not just children. Although today our topic is helping children, but actually a lot of time we use play therapy on young people, on adults, or even senior. Yeah, later I will show you why we can actually use on different age of people, because the tools that we use is more than what you can think of. Just that the tools that we are given, the way that of different age group that they may use it differently, so that we actually can use it on adults as well. And then the second source for the definition is from X-Line. X-Line is actually the psychologist in the 20th centuries. In her book Play Therapy, she says, play therapy is based upon the fact that play is the child's natural mediums of self-expression. It is an opportunity which is given to the child to play out his feelings and problems, just as in certain types of adult therapy. An individual talks out his difficulties. So like when I was doing counseling with individuals, they normally talks to us, right? But for children, it's actually very hard to make them talk to us because their language development is not up to the certain standards that they really can express themselves very well. So in the session, they actually play out the feelings, right? They play out their stories, play out their thoughts, play out their emotions. Yeah, then what is play? What is play? When we are talking about play, it's not normal kind of play, because many parents will thought of play therapies that they actually think that, can I just play with my kids at home? Is it also therapy? Yeah, you can actually play with your kids at home, but it may not be therapy if the parent is not trained. When we are talking about play therapy, it's actually called talking about therapeutic play. So this is a method of helping children with emotional, social, and behavioral problems to help themselves. Okay, let's come to this method. This method is actually a special technique, a specific way how you interact with the child, and also with the toolkits provided, so that we provide a very safe environment for the child to play out the feelings and problem. And a lot of time, we are not giving solutions to the kids. If you are helping professionals like counselors, there are a lot of time we are not actually telling the clients what they need to do to solve their problems, but we guide them to find the solutions by themselves. In play therapy, it's also very similar. Most of the times, I'm not telling the kids what they need to do to solve their problems or to improve their behavior. I actually help them to find a way so that they are able to help themselves and get healed. Okay? And then the last point is that with the therapeutic objective. So when parents or teachers that refer to us, normally they already know what they want us to work on. That can be the therapeutic objectives, right? It can be like, I want my child to improve in the anger management, or my child is very anxious. I hope that my child can cope better in his emotion. Sometimes it can be behavioral issues. Some children, they are not able to regulate the emotions. They are very aggressive at school. They may hit people when they were triggered. This all can be the therapeutic objectives. So when we are talking about therapeutic objectives, that means we have a goal to achieve. It's not just play, right? It's not just play for fun. Although a lot of time, it's actually a lot of fun in the sessions, right? A lot of kids that when they come to my playroom, they would like to play longer, and then they will drag, and then they refuse to leave the room. So it's a lot of fun. But when we are talking about therapy, it's not just fun, because when we are trying to take out the emotional dirt from the wound, there may be some pain in the process. Let me give you an example. I have met a 3-year-old girl. This girl, when she came, she was not able to talk very well. Actually, sometimes I don't really understand, what all she said, but I was able to guess. She's just started to attend a preschool in Singapore. So she was referred to me because she have witnessed some family violence at home, and the grandmother was actually very worried. When she came to me, she always talked to me that she has two mothers. What happened is that this child had never seen her mom. Her biological mother left her after giving birth to her. So she have never seen her own mother. When she entered preschool, I guess what she learned is about family, right? So normally in the family, there's a mother, there's a father. But for her, she have never seen her mother. So in the play therapy session, she always asks me to pretend to be her mom. So she wants me to talk to her on the phone. So she was playing, the role of a child, and I was playing the role of the mother. So she was trying to process her relationship and feelings towards the mother. So in one of the sessions, she asked me to dance, right? Part of our toolkits is actually dance and movement. She placed a lot of ribbons on the floor, and then she asked me to dance with the ribbon, and then she sang. So she was singing, and then I heard from the lyrics that the lyrics is actually about the motherly love. I guess that the child learned the song from the preschool. So when I was dancing, based on her instruction, that she was very happy at that time. But suddenly she stopped. And then I saw that her eye was so red that I realized that actually she was processing, her relationship emotion towards the mother. So I stopped smiling and I stopped dancing. And I come to her and then I squat down. Then I said, "You must have been missing your mom so much." That moment was actually very short. It's less than a minute. Her eyes were so red, and then she was trying to hold the tears. Then she took a deep breath and then start singing again. So you can see, in therapeutic play, it's not just fun. There is an objective to achieve, and then the child is able to process the difficult feelings through play. And play therapy is actually an evidence-based approach. PT UK is the Play Therapy United Kingdom, just now we have mentioned. According to their clinical evidence base containing over 12,000 cases, show that between 77% and 84% of children show a positive change through the use of play and creative art therapies when delivered to PT UK standard. Okay, PT UK standards meaning in using their way of doing therapy on the children. Yeah, so PT UK have the integrative holistic play therapy model that they train play therapists all over the world, not just in England. I'm also trained by Play Therapy United Kingdom, but when they call play therapies outside of England, it's Association of Play Therapy International. So you will see that children, most of the children, you will see a positive change after receiving the play and creative art therapies. The more severe the problem, the higher the percentage of children that show a positive change. And if you are teachers or, you know, some professionals that you may need to know is the difference between play therapy and talking therapies, because actually some of my clients, when they come to me, they were referred by teachers. For play therapy, we are using play, art material, Centre is one of the tools, and other creative ways to help clients express their thoughts and feelings. Later on, I will actually show you the toolkits of our play therapy. It includes more than like art material and Centre in other ways as well. But for talking therapy, we are talking about that you're talking to a trained psychologist or counselors who can use different therapy models or questions to help clients express their thoughts and feelings in words. So when I was a counselor, I used our questions, right? It may be from different modalities, right, to ask our clients and process with them. But a lot of times you will see that the child may not be able to answer you, and they will just answer you like, I don't know. And that situation is actually very difficult to continue with the sessions. If for our younger kids, like what I was talking about, is a 3-year-old child, it's even more difficult to use talking therapy to work with them. That's why play therapy is a better way, more efficient way to work with children who are not able to express themselves in language. Okay, this is a slide extracting from the book called Working with Children in Art Therapy. From the diagram, you see that there was actually 2 lines. On the left side is the iconic mode of development of a child. And then on the right side, you will see that there is a linguistic development of a child. Iconic mode has a line of development that is distinct from the linguistic during early stage of development. What is talked about is that when a child, when they are developing, actually the iconic mode develops first. I show you a toy that some of you may have seen before to try to elaborate this point. This toy is like a shape sorter toys, right? And if you have child or like nieces or nephew, you may have seen them playing with this toy. So this toy is very simple. So you have to match the color, right? At the same the wooden block, and then you just insert right in the container. You will find that a lot of young child, before they start talking, they are able to play with these toys. Am I right? And then after some months, they start talking. The parents may start to teach them, oh, this is yellow, this is square, this is circle. They start to merge too, right? The shapes, the colors, and also the language. What it shows up is that the iconic development, you know, the image precedes the development of linguistic. When we are asking a child to explain certain things, right? Let's say they draw a picture and then you ask them that, what does it mean? They may just tell you, I don't know, right? Of course, there can be certain situations that they may not trust the therapist enough and they don't want to answer. But for young children, a lot of times that they actually really don't know. Why? Because they were too young. And when you are asking them to explain the picture, you are actually asking them to translate the iconic mode to a linguistic mode. But there is no linguistic counterpart. So therefore, they will answer you, I don't know. Right? After some years, you will see that they actually merge together, these two lines merge together, and then they are able to explain, you know, these images, what does it mean for this picture? Or even that they will actually give a title, a verbal title of this picture. So later, when the child develops representational drawing skills, he can marry the representational drawing to the linguistic classification. So if you ask me what age that they are able to answer you, from my own experience, it may be upper primary, it's about like 10 years old. They will be better to explain the teacher the pictures that what they draw. Like for a preschooler, a lot of times that maybe they just like paint or like draw two images. When they ask them, sometimes they will just tell me, oh, this is me and this is you. Then you want to ask further, what does it mean? They were not able to answer you. But from the play theme of the session, I can sense that a lot of time the children want to show me that we are together, we are doing something together. So the theme of togetherness is like, you know, always in the session. Actually, the child may want to tell me that she can feel trust to trust me. She know that I am actually journeying with her in the play therapy process. Now we look at the scientific research, neuroscience and creative art therapy. Neuroscience is a study about the nervous system and the brain. In the recent scientific findings, the brain and the body do react to the experience of drawing, painting, or other art activities. In the past, we always think that the left brain was the centers of logics, right? The right brain is actually the centers of intuition and creativity. However, when we are doing arts or doing play, both hemispheres of the brains are necessary for art expression because images are not just stored in any one part of the brain. And in fact, many regions of the brains are part of the images formation, storage, and retrievals. Then you can think of a play therapy session. The child can do a century, make a century in the center. Does this century have a lot of century miniature, the figurines? And then they use these symbols, start to tell story and form the pictures in the century. Can you imagine how many regions of the brains are actually used in this process? They are also using the language ability to actually explain what is the story about. And neuroscience research shows that more brain centers light up in response to metaphor than any other forms of human communication, forming new neural pathway. So there is a lot of brain centers in our brain. When we do certain thing, let's say we show a picture or show a symbols or tell a story, the brain center actually respond. Right? It responds better to metaphor. It can be actually in stories, right? Or symbols and the play than any other form of human communication. I have an experience like with my own child. That's 10 years ago. 10 years ago is that my child was actually very young. It's about, I think, 6 to 7 years old. Yeah. So at that time, I started the practice of play therapy in my own agency, but I didn't have any tools in my home. I didn't have any toys in my home. So a lot of times when he throw tantrum or he just break down, it took me an hour, it's really an hour to calm him down. Of course, he is a very rigid person. Yeah, when he was stuck, he have a hard times to like get out of it. So he would throw tantrum and keep crying. Yeah, so I didn't have any tools with me. So after having the concept of play therapy, what I did differently is that I start to tell story. So for parents, if you're thinking how to help your children, actually story is a very good form of mediums because there's a lot of metaphors in story. So I also write therapeutic story for children. So based on the situation of my child at that time, I'll just start a storytelling. And this story helped the child to look at the issue from a different perspective. And then he calmed down. So you see, we are actually trying to form the new neural pathway. So play therapy can rewire the neural pathway of children. That's why it's very effective. That who is play therapy intended for? Actually, for many issues, right? Bereavement or loss, separated, divorce, parents, underperforming, behavioral problem, communication problem, autistic spectrum, withdrawn, trauma, abuse, nightmare, delayed development, unauthorized absence, that means school refusal, social exclusion, bully, and bullies. Maybe I just pick two to explain what it means. For underperforming, it could be academic, social, cultural, and physical. I give you examples of one of my clients. A child, 9 years old, was referred to me because he has some suicidal ideation. He knows that his parent is going to divorce. At that time, parents are already separated. So the student care teacher found out that the child always look at the window, and they are actually very worried that, that he may commit suicide. So this child was referred to me. When I took this case, he didn't only have emotional issues. Actually, he had a lot of other issues. He didn't cope well in school. He don't have friends, and then his have another physical issue, which is actually he had bowel movement issues. Bowel movement issue. He couldn't control his bowel movement. So like when he goes to toilets, after going to toilets, the stool is everywhere in the toilet. So mom was actually very angry. He was already 9 years old, but he still couldn't control his bowel movement. So there are so many issues. When I started therapy with him, he started to use play and creative arts to process his feelings towards the father, a lot of time towards the father, and also the divorce of parents. I saw the child almost a year, I think less than a year. After the therapy, what I was informed is that the child has improved a lot in his study. He was given an award in school, which is a progress award in Singapore. That means the child has a lot of progress in academic during that year. So it's amazing because the child was emotionally so disturbed at that time that he was unable to focus in his study. After receiving play therapy, he could focus better. That's why his academic has a lot of improvement. And then the other is that he was able to set boundary with friends. He was always bullied by others at that time, that he started to how to articulate, how to set boundary, how to make friends. And then amazingly that, that his bowel movement issue is just resolved. Yeah, he was monitored by the hospital, a children's hospital in Singapore. But actually, doctor also couldn't do anything at that time. But after receiving play therapy for a year, the problem was just resolved. So you see is that how all these things are related. For bully and bullies, some children, they come to me because they were bullied, right? Just like the kids that I was talking about. Some, they have very low self-confidence. They may have speech delay. They didn't know how to talk to friends. They were bullied at school. Some that they were actually bullying others. That means they bully other kids. They can be very aggressive. They can be very controlling. They can be very mean to their friends and very harsh. So the parents found this is not a way to relate to their peers, and then they bring the kids to see play therapists. So see the benefits of play therapy. Actually, play therapy have a lot of benefits. It is very essential for children to develop physically, emotionally, and socially. It's foster imagination and creativity. A lot of times, we are not telling the kids how to play. So they have to think of a way that how to play in the room. I have some kids that actually I work with them for like quite long term. It can be like over 20 sessions. Can you imagine, that they have to be very imaginative because the toys in my room is actually the same. But they can be in my room for 20 over sessions. That means that they need to think of a ways that how to use these tools and play in the ways that they feel enjoyable. That's why it fosters imagination and creativity. And a lot of them, they feel much more confidence after therapy. And then it's encouraged their concentration as well. It helps children to make friends and learn about their ever expanding world. and it allows them to learn from mistakes safely. Sometimes they do make mistakes, but I also set limits for the session. Yeah, so if there is no safety issues, they are able to play in many ways that they want. And then play can be used to establish a relationship, and it is used when talking therapy doesn't work, and very often it happens to the children. Okay, now we come to the play therapy approach. A lot of people that they may not know that actually there are different types of play therapy approach, but mainly there are two types. One is directive, one is non-directive. Okay, for directive, meaning what? It's the therapist is the one to lead. So I will be the one to lead and tell the kids what they are going to do. For examples, recently I actually have done a quite directive activity with a child. The child has some anger management issue. So the mom really want me to teach the child some skill, how to manage this anger. So you know what I teach the child? Actually, the most basic thing is that how to take deep breathing, right? When the child is in school, he was triggered, he was not able to control his emotion, he may hit people, and he got nothing, right? So if he is able to know how to take deep breath at that point of time and cool down, he may not need to hit the peers. So when I was teaching or actually helping the child to learn these skills, I need to use a fun way, right? So in that session, I already planned that part of the sessions that we are trying to learn these skills. And then I prepare a lot of balloon. Yeah, so he was actually P2, 7.5, right? So we are blowing balloon, but blowing balloon is actually not very easy for a young kid. So they need to take a deep breath, right? 4 seconds, and then hold the breath, and then blow out for at least 4 seconds. So he try many times, in the session, we are blowing balloons together. There was a lot of fun, right? And then it will help remember how to take deep breath when he was really triggered and angry at school. That is directive way of play therapy approach. Of course, there are other ways as well. So the main difference is that the therapist is the one to lead and the child will follow. So you will see that because you already planned activity with the kids, you also will restrict other way of playing, right? That was the drawbacks, that you may not be able to see how the child to use their creativity, imagination in the play. But you can contain the chaos, yeah, because you are not giving a lot of tools for the kids to use. So it's less chaotic. But for non-directive play, it's very, very different. It means that the child is going to lead, and then the therapist will follow. What it means is that you are not going to plan anything for the kids to do in the session. The child is going to tell you what he wants to play in the session. And later I will show you what type of tools that I have. I have many, many toys in my room, okay? Almost 10 different types of toys in my room. So the child have to think of the way how to use it. He may want to involve me in the play sometime, but sometimes they may not want to involve me in the play. They play alone. Okay, so what is my role then? My role is actually reflecting what I see in the session. A lot of time, I was like a mirror. Letting the child see what is in the world. We call it reflective skill, reflecting play. That means that I'm reflecting two things. One is to reflect the contents of play, meaning what the child was playing. The child may want to play music. Let's say he likes to play drums and play music. Then I will reflect to the child that today you really want to play music. You want to beat the drum, right? Maybe the next moment he will actually go to the sand tray. Oh no, now I want to play with the sand tray. I want to play with the sand. Okay, then I will reflect that, oh, you are really interested in playing in the sands now. So I'm reflecting what he wants to do, his action. Okay, and then the other thing is that I will reflect is actually the emotions. Yeah, at times you will see the emotions of the child. Yeah, but not all the time. That's why sometimes you don't see emotions. You only see the content of play. Sometimes you will see the emotion. examples, a girl to see me, she was actually very, how to say, very mean, sometimes very mean to the peers or teachers. You know, she likes to break the rules, she doesn't follow the rules, right? And then sometimes she was also very harsh to me in the session. Harsh meaning that in the play, right, when we have role play, he could be very harsh to me, saying something really very mean. And then he got really angry with me. Then I will actually start to reflect the emotion of the child. I may actually reflect that you are not happy. You are not happy when I cannot catch up with your pace. So I reflect the emotions of the child. You see what is the benefits of non-directive play? Because we are not directing the child, we actually create a very safe environment and space for the child to go to the subconsciousness. And what the child plays is actually telling us something happening in her inner world. If the child doesn't play out in the session, actually nobody knows what happens to this child, why he behaves like this, why she was so mean to the peers. So for non-directive play, we are actually tapping the subconsciousness of the child and understanding what happens to the child. Of course, for a very experienced therapist, we are able to integrate both skills. That means that in one session, we can be directive to non-directive, non-directive to directed. You know what I mean? Yeah, so we integrate the skills so that we can achieve the best outcome for the session. And this is the two kits for play therapy. Just now I mentioned that we have Sandtray, we have art, and that you may not know is creative visualization, also called it guided imagery. Later on, actually, we will try this activity together. Okay, I hope that you all enjoy about it. And then we have dance and movement, we have Sandtray, art play, storytelling. Sometimes not I'm telling story to the kid, that the child will naturally tell story in their play. Yeah, we just need to learn how to respond to the story. And then I got music, like puppet, and very often that we have role play in the session. A very common themes of role play in the play sessions will be like police and thief. Yeah, the child may ask me to be, okay, now I will be the police and you will be the thief. According to non-directive play therapy, I will be the thief, right? So I'll play the role that she wants. So they may want to handcuff me and then put me in the jail, right? The other role plays that always happen in the play sessions will be doctors and patient. So the child may play the roles of a doctors and I'll play the role of the patients, or she will ask me to bring the baby doll to be the patient. And then we have the role play together. This is the categories of play. Yeah, so you will see that there were nurturing and family toys. Baby doll is one of them. Dollhouse, baby milk bottle, kitchen set, pretend food, and puppets. And then we also have scary toys. So you see there is a big difference, right? Nurturing and scary, and some aggressive toys as well. So for the aggressive toys, we have swords, gun, knives, handcuffs, sheaths, ropes, and toy soldiers and tanks. Okay, be mindful that if you are going to put swords in the room, you put the sponge one. Sponge ones, if you have Daiso in your country, they often sell the sponge swords, right? Don't put the plastic or the wooden one because the child may actually initiate fighting with you. So it will hurt you, right? Or you hurt each other if you are fighting. So I always put the sponge swords in the room so that we can have some aggressive play. And they need to do that at time because sometimes they want to feel strong, you know, or they are in control. So they were in initiative kinds of aggressive play, but it doesn't mean they want to hurt you. They may just play that in the play role so that they can, you know, feel like to be strong. And then I got some expressive toys like paint, clay, Play-Doh, marker, scissors, art and craft materials. And I have some recycled materials in my rooms. If they want to build some things, they actually can make use of the recycled materials to build something. And then they have Sandtray as well. And then pretended fantasy toys that I have some dress-up clothes, magic wand, flying wings, mask, jewels, toy phone. If you put toy phones, you always put 2 sets because the child may actually want to like have a role play also, like talk to you on the phone. And then Dr. Kids, Zoo Animal, and blocks. Others I put is actually musical instrument, drums, especially drums, I put 2 sets as well, because sometimes the session can be very non-verbal. They don't really talk to you and they are just playing. Then if they are not talking anything, I will also use the musical instruments to actually respond to them. So I will always have 2 sets. Then I got fans and pom-pom, gym ribbon. Mirror is for them to dress up. When they dress up, they may want to see themselves. And water. Water is more for the paints and sometimes for the sand as well. So this is my current playrooms. Yeah, actually I practice at my home in Singapore. So this is one of my room that I transform it to a playroom. So there's another angles for the playroom. Then if I only use sand for that sessions, I may just lay out all this sand tray, this miniature at the side. Yeah, and the children play on the floor. Yeah, children like to play on the floor. Like even you give them chairs, they would like to play on the floor. So I will put the sand tray miniature in category because I don't have enough space, or mainly it's because I've got many tools in my rooms. I don't have enough space for this sand tray miniature. That's why I will put it in a tray and then actually put it in categories so that it's easier for the kids to find. But when you're talking about a sand play or sand tray therapy room, it could be something like this. Okay, you can see that they put all this miniature on the shelf, right? It's all this miniature. It's very easy for the client to see. And then there is a sand tray in the room. That obviously this room is not just for kids because you can see that the miniature is like up to the, more than a meter. Yeah, so as what I say, play therapy is not just for kids. It can be used for adult as well. So sand tray and sand play therapy is always used for adult. It's not just for kids. But just that I couldn't afford to have this kind of room, so I stack up. Yeah, I have some art and craft materials and then some musical instrument, dance and movement. For dance and movement, I have this one is actually the long tail fan. Long tail fan, so they can dance, and some traditional fan. And this is the gym ribbon. That's more for the movement. And then I got some pretend aggressive toys. So you see, I got the Daiso sponge sword, right? And then this toy knife and toy gun and Nerf gun. And then some pretended toys like the kings, the wizard, the private, firefighter. Sometimes they wear the sunglasses, then they pretend to be the police officer. Okay, and then there's the dress-up costume. So they may want to be a superhero. They may want to be a police, playing the police and thief games. And then I got dollhouse, and they like to use these rabbits toys to move around in the dollhouse to show a lot of interaction between the child and the family members. And Lego, for older kids, I may have this small piece of Lego. And then for younger kids preschool, I will have a bigger block. And mask, baby doll, and medical kits. Even for baby dolls, right? You don't assume that they may be not, it must be nurturing. Sometimes the child may mistreat the baby. They may drop the baby or they may hit the baby according to what they have experienced, right? Because we also know that a lot of kids that experience trauma, yeah, they may actually mistreat and hit the baby. They may not nurture the baby doll. And shopping toys as well. Okay, so now we have activity time. What are we going to do is that I will invite some all of you to do something in the chat. So I'm going to show you some picture on the screen. When I show you the picture, you can actually type on the chats. Okay. Let me see. How do I see the chats? How do I see the chat, Paul, if I want to see the answer? Oh no. How do I see the chats? I need to
There's a chat at the bottom there. You just move your mouse to the bottom of your screen. Can you see the chat box?
chat box.
You click the chat.
When I'm showing, is it this one? No.
No.
No. Stop
Okay, you go.
sharing first.
You
Come out, I can see the chats. When I'm showing the screen, I actually cannot.
okay. Why do you open the chat first?
Open the
Okay,
chat first. Oh yeah, I'll open the chat first. Oh.
And then yes, go back to
Yeah,
your
then we can share.
open. Yep.
Oh, thank you. Okay. Okay. Sorry, how do I go back to? Okay. But I still cannot see the chats. Never
No worry.
mind. Maybe I just continue. Okay. I just continue with my activities. So I think Paul can see the chats. Okay, I'm going to show you the symbols. The symbols. There's a lot of pictures, a few pictures on the screen. When like this one. Okay. Can you just think of a person when you see this picture and then you start typing in the chats?
Marco say the Pope. Shumei say Pope Francis. Nan say Jesus.
It could be a person that you personally know, or a person that you don't know,
Thomas say
right?
mother.
You don't need to give me a name, right? Maybe you can say, oh, your mother, or, the relative of family members. Do you see different answer, Paul?
Yes, the answers. Faisal say Mother Teresa, interestingly. Nancy say grandmother. Sharon say my youngest son. Oh, Abigail say my husband. You say grandmother. Oh,
Okay.
say Holy Spirit.
Okay. Now, next. Hey, I didn't work. Okay, think of a message. It could be a very short sentence or very short paragraph. Okay, I give you some times, right? Very short sentence. Just type in the chat.
Less traveled road. Nancy say less traveled road. Charlene say life is a journey. Abigail, the road is narrow. Jen say calm day. Shumei say relaxing drive in greenery. Wow. Tom say calm. Jess says keep going. Marco say journey. Faisal say but mysterious future. Wow. Interesting. Sharon say life is beautiful. Jen say to the unknown. Nancy say keep moving forward. Clark says let's go for a run. Wow.
Okay, let's go to another thing. Think of an emotion.
Emotions, calmness, joy, happy, relief, happiness, gratitude, still,
Okay.
cold.
Say.
Because it cold. Because it Janila say cold. Because say bland. Say Marianne say hope.
Yeah, thank you. Thank you for your answers. Okay, what about this one? If I say a father is like a rock, what can you imagine how this father is like?
Strict. Sharon say.
Possible.
Drew said foundation. Grace is strict. Charlene says strong and constant. Jenna says strong and brave. Marco said this one. Kim say
Say.
tough love. Sharon say keep the family wounded. Nancy, interesting, say cold. Amy said reliable.
Say.
Sophia said cold-hearted.
We have different answer, right? You are right. I'm giving the same picture, but the fathers can be strong, tough, or provide a sense of security, stubborn, inflexible, stability, and all include all the answers that you have given. Why it was like that? Because a symbol or metaphor has a depth beyond its external form. It's more than a sign. It's a powerful symbol or metaphor may lead to many thought paths. That's why you give me all different answers. And it provides the means for a child to look at his powerful feelings from a safe distance. Can you imagine if you are talking to a child whose parents just divorced, then you keep asking them or asking the child that how they feel. Actually, it's very scary. It's that they don't want to actually face the feelings or talk about it. But when I'm talking about a story, metaphors, a story of divorce, it's much easier for the child to stay with it, right? And then process the feelings of the parents' divorce, because it keep a distance, right, from the child, and also the feelings, right? It's just the feelings of the story characters. When I read out stories of divorce, most of the kids, almost all of the kids, they were able to identify with it. And then they feel safe to process the feelings further. Some of them even, they respond in that way. You must have been talked to my parents. Why do you know everything? Actually, I tell the same story to every client, every child who's experienced, the divorce of parents. It's not just her, but that they just can identify with my story. And this is exactly how they feel. Whereas metaphors allow people to shift their perspective and unlock a way of thinking that do not work. It's like my son. No matter how many times I told him not to do this, calm down, no crying, mommy loves you, it doesn't work. But when I start to tell a story, he stopped and then look at me and then calm down. Okay? And simple metaphor will be used many occasions, like almost in all of my tools, right? Centric, clay, puppet, artwork, role play, dollhouse, storytelling, and creative visualization. So it's very important for you to know about this if you work with children. Now we are going to the last activities, the creative visualization. I hope that you already have prepared. Yeah. If you have not prepared a piece of paper and some marker and color pencil, I'll give you some time to go and get it now. If you are ready, you can show Paul, just in the chat group, say ready. Then we will start. Okay, we are going to do this creative visualization, also called guided imagery, right? After that, we will need to use some time to draw.
Some of you have said ready.
Ready, yeah? Okay. So can we start? Okay, so let me explain this activity. I do this activity with a lot of young children and also adults or teenagers as well. Okay, what we'll do is that you have to close your eyes when you're doing these activities. And I will have a script, basically a storyline, a script that I read out. You will follow my script to visualize some image in your mind. Okay, I always explain to the children, do you believe that we can see things when you close your eyes? Some of them say yes, some of them say no, right? But actually we can, right? Imagine the times that when we are all sleeping, we all dream, we visualize the things, right? We can, our brain work in that way. Even we close our eyes, we actually can visualize images. Yeah, so we prepare the kids and clients that I actually tell the children that I'm not going to touch you or let anyone come to the room during the activities, because they have closed their eyes, that maybe some kids, they don't feel safe. So you must prepare the child that you will keep them safe. And you are not going to touch them. You will just read out a script, a storyline, so that they can visualize things in their mind. Okay, when they all say ready, then you can start. Okay, we are trying this. We're trying this in this Zoom session.
Yeah, we have a question here, which I thought is quite interesting. I should bring out to you.
Okay.
Janila says, what if I'm not good at drawing? Same thing. What if the client is not good at drawing? Should we exercise still?
Okay. If the child told you, I don't want to draw, I don't force them to draw. Okay. Yeah. Just just discuss with the child what he has visualized, in the storyline. That would be sufficient. But some kids, they will like drawings. They would love to draw. Then you will let them draw. Some kids that they may prefer to use the stand tray to actually have a discussion with you about this activity. Okay? Okay, can we start?
So now, Jeannie is going to ask you to close your eyes. And then You
So,
are going to listen to her read the script.
yeah, I'm going to read the script with all of you already. Okay? Okay, let's start. Imagine yourself breathing deeply into your tummy. Let's close your eyes. Breathe out all the air until you can feel your tummy sink inwards. Let's do this together a few times with your eye closed. Breathe in, breathe out. Breathe in, breathe out. Now, I want you to see before you a path in nature, any way you want it to be. Wide, narrow, winding, straight, by a stream or by the sea, in the meadows or a forest, whatever you like. Now I want you to walk down your path until you come to a tree with many, many branches. This tree is very strong. This is the trouble tree. The tree where you hang, put, leave behind in any way you want all your troubles. Pause a moment and offload all your troubles, no matter how small. Leave them all behind before you move on. Now continue down your path. If there are any rocks or twists or other obstacles, stop and gently move them to the side. Soon you arrived at a gate covered in your favorite flowers. Smell their lovely fragrance as you gently push open the gate. As you step through the gate, you enter into the most beautiful gardens you have ever seen. It is exactly the way you want it to be, and it is all your very own. All the colors in your gardens are very bright and beautiful. The sun is shining brightly, and the birds are singing a welcoming song. You feel so safe and peaceful. A beautiful flower attracts your attention, and you slowly walk towards it. You hold the flowers in your hand as you notice its beautiful colors and shape. Wander through your garden for a while and explore it. Now, before you leave, you need to say goodbye to your garden, knowing that your garden will always be there for you when you need it, and that nobody can come in unless you invite them. Now walk slowly back through your garden to the small gate. Smell once again the lovely fragrance of the flowers that cover it as you push it open. Step through and close it behind you. Walk back along the path you came until you see the trouble tree. Walk past and continue down the path. And now you may open your eyes. Okay. I would like to give you 5 minutes to draw the pictures. When you are drawing the pictures, I will actually play some music, so that everybody take out a piece of paper and then you start drawing the image that you've seen in the creative visualization activity. Let's start.
Okay, shall we move
Time is
on?
up.
Yeah.
Yes. Okay. So I would like you to actually share your experience. Maybe you can just type a few words in the chat. So, how was your experience when you were in this activity? Any one of you can see the trouble tree.
How was experience? Jen say yes, you can see rubber tree. Tom say relax. How about the rest of you? Genia say yes, therapeutic.
Mm,
Angeli say fun.
yeah.
Wow.
Yeah, it's very
Sharon said
relaxing
very,
and beautiful.
very relaxing and beautiful experience.
Oh,
Nancy said I feel relief. Jen said imagining it make me relax. Kara said drop all my luggage on the tree. Wow. Faisal said feels like a child again. It gives me hope. Anila said I feel so relaxed and I honestly cried before drawing it.
yeah.
Naruto Nirodora say peace.
Yeah. Okay, so you see, many of us actually we have a very tired day. I was actually thinking the way that I should do this activity because it's at night, so I was wondering whether you would doze off when you close your eyes. But actually, all of you did amazingly, right? That you were able to process the feeling. And when I work with my clients with these activities, a lot of time, they share with me how was the trouble tree like, and then I will ask them, what is your troubles? Actually, we also can talk during play therapies. That I have no time to actually ask you, right? How was the trouble tree like? What are your troubles, right? Then you discuss with your clients, and then when they see the image of the gardens, that everyone's garden is completely different. We are also tapping the subconsciousness of the child and the clients. How is it like? So you actually explore together with them. When they draw it out, you can actually ask them, oh, how was it like? How do you feel in the garden? And a lot of times we use these creative visualization activities to provide a safe space for the kid. So I would tell the clients that whenever you feel anxious, right? Some of them, they do need the calmness in them. Think of the garden again. Okay, remember, they pick the flowers. They pick the flowers. Whenever you do this action, you pick the flowers, you go back to your gardens. Okay, so that you can make yourself calmer when there is an image in your mind. Okay, I think time is up for my presentation and that we will go to Q&A session.
Here's a question. What happens if somebody tells you something very absurd from doing as a therapist?
Oh, that I will be very happy because she trusts me. The child trusts me to tell me he's very upset, right? So they really feel very relaxed to share with you everything, right? So let's explore with the client that what they see in the image first. It may be, some of the past experience which caused the sadness, right? And then what do they find? What do they find in the garden that you can actually tap it as a resources?
Angeli,
If the
Angeli
yeah.
said, I don't know why I thought of shoes and threw it on a branch of the trouble tree. I mean, how would you answer to that? Would you think that, how would you even continue the conversation, for example?
Yeah, then I feel very interesting because everyone throw different things.
Mm.
Throw different things, right? So maybe I also don't know why, because some clients that they share that they throw different things. Yeah, if I was talking with you that you are throwing the shoes on the trouble trees, yeah, then I may ask the clients that, oh, is there what the shoes like mean to you? What does it mean to you?
Mm.
Yeah, what does it mean to you?
Mm.
Yeah, how was it like when you're throwing the shoes towards the tree?
Right, right.
Mm.
Mm.
Any
So,
other question, not just creative visualization activity, any other question about play therapy? What is a typical days of a play therapy like? Oh, okay. So, okay, for me in Singapore, right, all our children go to school in the morning, right? So I only can see children in the afternoon. So my typical day is like that. Morning, I may schedule some online sessions or sessions with parents, or adults. Yeah, and then I will reserve all the afternoons to see children. So I may have like 2 to 3 sessions in the afternoon. Actually, a lot of time is 2 sessions because we have to do a lot of clean up between the session. So can you imagine when I play with the kids for 50 minutes, sometimes I also take 15 minutes to clean up the room and then start another session. Okay, so there's another session, another question, very long question.
Jen asked,
Do you
do you do group play therapy as well?
When I was working in agency, I did do group play therapy, but now I'm not doing group play therapy because of the room is very small. So I'm practicing at my home, so it's pretty small. So I don't do group play therapies right now, but back then when I was working in agency, I do. Oh, okay, thank you. Say I have young client experiencing sexual trauma. I was thinking of using doll. I bought for this certain purpose to help one of them express and pour out about the incident. Besides this, I'm also hoping to help her learn boundaries due to the trauma reenactment she has been acting on lately. What tips and advice can you give to me as I make play therapy as a primary therapy? Okay, so you already have your plan, right? Because I think you already have your plans that you mix of the baby doll and to see whether the child is ready to show you something, right? If this is a very directive session, I'm not sure whether you wanted to use it very non-directly or directly, right? If it's very non-directly, maybe you wait for the child to show you that. I believe that if a child is really sexually abused, right, the play with the baby doll can be very different. Yeah, maybe she was trying to attack the private part or it's different from normal play with baby doll. But if you are thinking it's a very directive sessions, yeah, so you actually, yeah, it's actually less scary, right, when you're talking about the incidents that on the baby doll, but not on herself. Yeah, so you may actually want the child to show you how is feelings like when you know that you are touching the baby doll, and let's see how it's move on and how it goes, because I would think that it's actually very difficult for our kids to talk about it, and it also depends on the age of the child. Do you also do play therapy training? Yes, we do it play therapy training in Singapore. It's a 1-day workshop for Origo. And another play therapy trainings we are thinking to start is actually using a non-directive play therapy model. We call it child-centered play therapy, to teach parents, especially parents, how to use it on their own kids. Yeah, so that parents don't need to think of activities to do with the kids. They just need to know the technique, how to play with their kids. So it's a very non-directive play therapy models that we are going to conduct 1-day training for parents and all the professionals who are interested in learning child-centered play therapy. Do you have some sort of rituals before you have your play therapy session with clients? And what do you do if during the session? Oh, okay. Rituals. Okay, my ritual is very simple. Okay, and every one of them that they actually come in, right? They have to wash their hands. And then the other thing is that I have attendance sheets for them. Children coming for therapy, they need to come here for a period of time. It can be 12 sessions, 6 sessions. Yeah, because we need a process for the child to process everything, right? So they will know that how many sessions that parents have already committed, so that there's a timeline in them. So they have to color the box before they start. And then there's a rituals after closing as well. I mean, before closing the therapy session. So I will do some activity for them for a closure for the therapy. Do we still have time to answer all the question, Paul?
Maybe 2 more questions, Jeannie. You want to read a question and answer them?
Okay. If you're doing group play therapy, what is the ratio of you and the child? It's also it depends on whether you are trying to use directive play therapy or non-directive play therapy. If it's directive play therapy, you can have more children. Right, it's also depending on the age, right? If they are older kids, maybe you can have more than 5. But if you are doing non-directive play therapy, that means they can choose the tools and the ways that how to do it. Then I may prefer a smaller group, less than 5 people. is there an ideal number of sessions, or it depends on the case? And can you give some tips on how to give feedback to parents after some? Okay, the ideal number of sessions for non-directive play therapy is 12. It's 12 sessions. But if you don't have the times, right, you already plan to be a bit directive and then using some skills of play therapy, then I think 6 sessions is also possible. When I was working in the agency, I often have not enough time to see the client so often. So I plan the 6 sessions, therapy for the child, and a bit more directive most of the time. And
Okay.
then,
Jeannie, shall we be
okay,
able to? Okay.
stop
What
it.
we'll
Okay.
do is that because we promised everybody we start at 9:30, so we want to honor that. But we will close by 9:30, and if any questions, you can stay back and we can continue the question and answer about it. Okay? So for the sake of honoring our time, let's continue. But if you have any questions, you can stay back and we can continue to answer your questions. Okay? Because we really appreciate your questions. So thank you again. Thank you, Abigail, for saying thank you. Genia, thank you so much. Shumei, thank you. Many thank you for us. We really appreciate that. We just hope that this session will be useful to you, and that if you have any questions, just let us know your questions. Okay? So if not, then thank you for attending. We'll see you again in 22nd May. Okay. Anybody want to ask any questions?
Did we answer the questions that they previously asked?
Okay, let's try to go back. Huh?
I think I haven't completed some of the questions.
Virginia asked, do you have a team with you doing a therapy?
Let me go back to the question. Okay, currently I am doing the practice individually, so I don't have a team. When I was working in the agency, we do have a team of counselors, and I have the play therapist and counselor as well. There is another question that just now we are talking about the rituals, and the other question is that, and what do you do if during the sessions you were triggered by the behavior of the clients? Okay, so one of the things that we do in the play session is that we do set limits. If the child is trying to cross the boundaries, we need to tell the child that they cannot continue to play. But we have, a procedures, so-called. So what I will do is that I will reflect the desire and the feeling of the child. Let's say he is trying to load the gun and shoot at me. Right? This is not allowed because it's about safety, right? So I will actually reflect the desire of the child. I would say, I know that you want to shoot me. Okay, that's the desire of the child, right? In play. Okay, then I will set the limits. Then I will tell the child that, but you know this is not safe and you are not allowed to shoot me when you load the guns with the bullets, right? And then after that, I will direct the child for alternatives. So I may tell the child that you can shoot at the puppets, or you can shoot towards the curtain. So they have freedoms to make choices. It's a safe choice for them. Okay, and then the other question is, if doing group play therapy, what is the ratio? Oh, I've already answered. Number of session depends on oh, is there an ideal number of session? I also answer. How do you give feedback? How come I go back to the top of the question?
Jamila asked, can a classroom include play therapy?
Okay. The classroom teachers, if you receive the training of the play therapy, of course you can. Actually, quite a lot of play therapies that background are teachers. Yes. So for Play Therapy International, they do take in students who have experience with children. So they may not be counselors or psychologists. They can be teachers as well. If it's more intentional purpose, like knowing deeply the child, what would be advisable? Can teacher do group play therapy or individual? You can after you receive the training. Otherwise, it's a bit difficult. Are there cases that is more applicable to non-directive or directive play? Okay, I think it actually depends on the type of the presenting problems. If a group of children, they all have like social relationship issues or anger management issues, that would be easier to conduct a group, therapy for them. But for some cases, may be a bit difficult. let's say the child may come in that, or the parents say she has like very low self-esteem. That would be quite difficult. Yeah, because there may be a lot of baggages, in the child that she or he has to tell the therapist through play. So in a group therapy session, it may be very difficult to like really focus on the needs, individual needs of the child. But if some things is like, how to say, that more you want the child to learn some skills, that would be easiest to have a group therapy. Like in the past, I may have a group therapies for like helping a child to learn social relationship, or like learning how to do anger management. That would be like more applicable. And then as therapists, how do we know if a tool or toy is suitable for the clients, that the clients have to choose that favorite toy? The play therapists, okay, for directive play therapy, they may actually choose the tools for the clients already, right? But for non-directive play therapy, normally what you see from my playroom is that we offer all the tools for the kids to choose. So they can actually choose any toys that they want to use. You will see some clients, they may like some tools more than the other. They may not touch some certain tools. Then you will know that actually they don't like this, right? So they choose it for themselves. Yeah. So you don't really choose for them for a non-directive play therapy approach. Okay, can I answer? Okay, do I answer all your question? No more. Okay.
Okay. Okay. I think I just have a few more questions. Marianne asked, does confidentiality rules
So you have a few more
apply like counseling
specific
sessions
calls.
for play therapy? So, I mean, basically the question is, does play therapists need to keep confidentiality rule like in counseling?
The confidentiality ones, right? Yes, correct. Okay, for parents, if you want to know the details of the session, actually it's not necessary because they will know the symbolic meaning of the play. A lot of time, the play is very symbolic. Even though we explain to the parents, they may not be understand. But what I share with parents is always the assessment. What's the assessment after the session? They don't need to know the details, but they need to know the assessment. For example, if the child play out the feelings, that they need the support of the parents, or they need some boundaries, they have some boundary issues. That is the assessment. I may work with the parents that how to set rules and boundaries at home. Okay, so we didn't break the confidentialities because I didn't tell the parents that what the child's, play and do. But be honest, a lot of times, if the child knows that I'm meeting the parents, if they are older kids, I'm actually tell them that I'm actually meeting your parents tomorrow or next week. What do you want me to tell your parents? A lot of kids, they will actually answer that you can tell them anything because to them, I just play, right? So to them, it's not really confidential. Okay, and what specific course can we get to be entitled as a play therapist? Just now I introduced the PT UK, right? Play Therapy United Kingdom. They actually train play therapists all over the world. So those play therapists who are outside of England is under Play Therapy International. So in Singapore, they train play therapists in Singapore, I think in Indonesia, in Malaysia. Yeah, I don't know about Philippines. I think may not. Yeah, I think may not. Let me go back and check. So we do take the postgraduate certificate level first, and then after that postgraduate diploma level. And PTI internationals, right? They actually can link it to master degree. Can I kindly ask if where we get the certificates? Okay, certificates.
This is regarding to if you're talking about being a certified play therapist, then PT UK and whatever will give the certificate. If you're talking about attending a full day course with Genie or the e-course, then Oracle will give the certificate, right?
Okay.
Okay.
Yeah, thank you for gaining a lot of knowledge and fun in visualization. Is it possible to have sessions that are directive and other sessions are non-directive? Yes, I do often. Yeah, sometimes in one session, I may have directive part and non-directive part, but just that the therapists have to know that how to move along. It's not easy, but some they will just to be directive, some are just non-directive. But for me, it's both. Sometimes certain session is directive with non-directive. Some session is all non-directive. Okay. Okay, I answered all the questions. Thank you.
Okay, thank you so much again for staying extra long hours with us.
Yeah.
You are extra blessed with more knowledge. Okay then. So we call it a night to remember, a night whereby you learn some new things. And do remember that if you need any help, then just give us a text, give us a call, and we'll be there to help you as much as we can. Okay.
Okay, thank you so much.
Okay, thank you so much then, everybody. I'm going to close the session now. Okay, goodbye. I mean, can you close the session as well?